Okay. So as you can see here, you know, a lot of my patients will come in and they may need an operation for, and typically it's for something like orthopedic, maybe they are going in for an ACL repair, or maybe they're going in for shoulder surgery. So my patients sometimes have had to get a mature procedure for their prostate. Another patient had an appendectomy, right? So again, various things. And these are just some generalized things that can help with the recovery process. So one thing to look at first and foremost is the clinic does offer a kit that's kind of targeted towards healing, and that is the regenerative healing kit that we have at BPC-157. And it's comprised of two peptides, BPC-157 and thymosin beta-4. And they are discussed a little bit at the refillsumma.com website, but I figured I'd go into them in a little more detail so you can kind of understand why they're so powerful. So the first peptide here is BPC-157. So it stands for Body Protection Compound. So what exactly is it? Well, it's a peptide that consists of 15 amino acids that's normally found in gastric juice and hydrochloric acid, the juice that's in your stomach that helps you digest your food. And understandably, it's really important in healing stomach ulcers, because that's something that a compound like this will encounter. But what researchers have found is that it's really key in healing skin wounds, muscle and tendon and ligament, as well as bone injuries. And there's been quite a bit of research on it, most of which in the past were done on animals, but they're finally starting to do a few clinical studies as well. And here's an interesting one right here, which looked at its effect in accelerating musculoskeletal soft tissue healing. This, I think, was a review article that looked at all of the different articles out there that indicated it can help with muscle and tendon tears, which is really cool. There was another article that looked at its effects on GI inflammation. And so I have a few patients that suffer from IBS and even ulcerative colitis, and they've seen some pretty significant improvement with injectable BPC-157. So just, something to think about there. The mechanism of action, well, it seems that it increases a couple of different items, increases a protein called vascular endothelial growth factor, and it also increases nitric oxide. Maybe you guys have heard about nitric oxide because it's really popular in certain supplements because it tends to vasodilate or cause blood vessels to get larger. However, in this particular case, we use it primarily for vascular growth, because that's part of as you're when you recover from a trauma, one key aspect of tissue healing is the ability for blood vessels to form and bring in nutrients that will help with collagen formation and fibroblast formation. And so that's where they think it seems to improve. Also, it seems to cause cellular migration. We'll talk a little bit about this a little bit more as we progress, but that's another component of wound healing. And then here's an interesting article. This was actually an animal study, and it looked at a transected rack Achilles tendon, right? And they actually added BPC-157 to certain rats and did not for others, right? And when they cultured these, obviously they caused the trauma, and they cultured the solution in a cell growth medium that actually allows these muscle cells to grow. And they found when they added BPC, the trauma healed much more quick versus those that did not receive BPC. So kind of really interesting. And this has been known for some time. So dosing. So through the clinic, we anywhere between 2 to 5 micrograms per kilo per day is what most people suggest. And we've elected to utilize 500 micrograms or 250 micrograms taken twice a day. We inject it sub-Q, kind of like the rest of the peptides. And you would there is some question, well, do you do this systemic? Can you inject this systemically, or do you have to inject it at the site? Well, both work, and in the past, just for simplicity, I just suggested injecting it sub-Q because it has to be absorbed, with the blood vessels, and then eventually traverses towards the area. But there is some anecdotal evidence. I've talked to certain of my colleagues, and some of them seem to think that it may work a little bit better if you inject it sub-Q closer to the site of the injury. Either way, though, I suspect the difference is not super significant. And again, we typically do it anywhere from 4 to 12 weeks. After about 3 months, that's the largest extent of its improvement. Well, what about TB4? Well, TB4 stands for thymosin beta 4. And what is this? Well, it's a protein that's produced by the thymus gland. So the thymus gland is this organ, part of the immune system, and it's right below your breast, right above your breastbone, right? And it's a reservoir of a lot of immunocytes, T cells and B cells. And thymosin beta 4 is a protein produced by this gland that has been shown to radically enhance wound healing, as well as it has some other interesting effects too. It's actually been not even cardioprotective. It actually seems to improve cardiac function. Here's an article that looked at patients who had heart failure, and they were utilizing thymosin beta 4, and it seemed to improve ejection fraction. Another article that looked at, this is a review article that looked at thymosin beta 4 and corneal wounds. So patients that suffered ulcers or tears in their cornea, the skin layer overlying your eye, and how it seemed to improve inflammation dramatically. Now, the mechanism of action, how thymosin beta 4 works, seems to be different than BPC-157. Instead of causing vessel growth and bringing in cells that help improve the wound healing cascade, it seems to radically increase actin. And actin is like this protein it's the most abundant protein that's found in eukaryotic cells. So eukaryotic cells are any cell that has a nucleus, right? So bacteria is a prokaryotic cell, no nucleus, and eukaryotic cells are ones that have nuclei, right? And so all of our cells have nuclei, right? And like organelles like the mitochondria, and lysosomes, and ribosomes, those remember from high school biology. And so it seems to dramatically increase actin proliferation, which in turn contributes to all these good things in terms of tissue wound healing, cardiac myocyte healing, and corneal healing. So the dosing for this is similar to BPC-157, in that you dose it subcutaneously, and there's been some contention as to the best way to dose it. So some people suggest dosing daily, other people suggest dosing twice weekly. We've revised the dosing regimen, so we typically will dose 1 to 2 milligrams twice weekly, because that seems to be a little bit easier on patients and quite effective. And you would take it for the same duration that you would BPC-157. And yes, it is synergistic because, as I mentioned, the activity is a little bit different than the mechanism of action is a little bit different than BPC-157. Okay, so those are the two main peptides that you can utilize to help with post-operative recovery, or if you suffer from like a tendon tear, a mild tendon tear, or muscle contusion that just doesn't seem to be healing appropriately, and it's not something that the surgeons think they think is operable. That might be something to consider. Last week we talked about causes for elbow pain. So obviously this is after you've done the simple measures of NSAIDs, using ice cup massage, maybe doing cross-body massage, as we talked about last time. If that doesn't seem to be helping these things, these two peptides might be a good idea. Also, of course, if you're having an operation. Now, what about like diet and supplements? Well, so just to give you an idea of what happens. So during surgery, obviously, they make an incision, they a lot of things that certainly causes havoc in your body, but the process of healing can be divided into three phases. Phase one, the inflammatory phase. So if this is like a cut, that's very simple.